I am Thomas Purgason MD. I'm a primary care internal medicine doctor in the Mansfield, Arlington area since 1982. And I'm here to talk about primary care internal medicine.
Okay, great. Can you tell us how someone would choose between a primary care physician versus an urgent care or an ER?
Well, I think it's very important that people have their own primary care doctor for urgent problems, because if you get ill and you call your primary care doctor and you go in to see them, number one, they're going to know who you are. Number two, they're going to be able to come up with a plan faster than like an urgent care center that doesn't know you. And number three, it's going to cost about 1/10 as much to come see your primary care doctor as it is to go to an urgent care center. Urgent care centers tend to charge according to emergency room rates, which are very high. And if you come to see your primary care doctor, you're going to pay your normal general fee that you normally pay for any other visit you make. So number one is convenience. Number two is the person knowing who you are. Number three is price. And unfortunately, pricing is important in today's environment.
Yeah. Out of the types of patients that you see, what is the most common illness or problem that you treat today?
Well, since I take care of mostly adult patients, well, all my patients are adults, I take care of chronic illness mostly, diabetes, hypertension, heart disease, those kind of issues. And then I also see people for their urgent medical problems. I take care of them long term, and if they get sick, say they get pneumonia, they'll come in and see me for that too.
Okay.
So I take care of everything from common everyday medical illnesses to people that have 6 or 8 different medical problems that they need to be cared for on a long-term basis.
Is there one that is more prevalent than the other as far as a disease, or?
The most common disease I take care of is hypertension. Second would be diabetes, and then third would be lipid problems and heart disease. And the most common diagnosis I take care of is allergies and upper respiratory infection.
Really?
Yes.
Okay.
The Metroplex is an allergy soup, and all doctors here become experts in taking care of people with allergy problems.
Okay. Excellent. Okay. With all the new technology and how fast things change today, how do you stay current in things that are trending, or new procedures, new medicines, new whatever?
Well, I'll go to conferences every year. Last year I went to about 3 different conferences on updates in medicine and how to stay current in medicine. And I'm very involved with University of Texas Medical Branch in Galveston, and so whenever they have a conference on new techniques and new medicines and new treatments, I'll go out of my way to go down there. And also, I take continuing medical education through the Scientific American Medicine, and I do probably 10 hours of continuing medical education a month. And then the American Board of Internal Medicine also requires me to take so many hours through their website every year. So I have like a 3-legged stool on how I stay current with advancements in medicine.
Since you've been doing this since '82, right?
Yes.
What's been the biggest thing or the biggest difference or change that you've seen?
Well, when I first got out of medical school, we had like 3 blood pressure medicines. Now we have like 300.
Wow.
So the pharmacologic treatment has multiplied exponentially since I've gone into practice. So just keeping up with the medicine is a full-time job. Also, the diagnostic imaging has really advanced. MRI scanners first came to the market in 1985, and they were a brand new technology that nobody knew how to utilize them. And since then, we now have CAT scans, MRIs, PET scans. We can pretty much take pictures of people down to the molecular level almost nowadays.
Wow.
So the technology and the number of advancements in medicines is just continue to improve. And 10 years from now, the landscape of medical care will be unrecognizable to those of us that practice it now. So keeping up is very important. They say that medical school is not to teach you the knowledge of current medicine, it's to teach you how to keep up with medical advancements. And I've found that to be true.
Wow. Anything else you'd like to add?
Well, I just think it's real important for people to have a relationship with their primary care doctor, because that's someone you can call. They're going to be there for you. They're going to know you. If you end up in the hospital, they can come to the hospital and take care of you and walk you through this troubled time in your life and hope you'll come out the other side whole. And that kind of relationship is really better for your health care, and you should go in and get your physical every year too.
Okay.
So those are the tenets of primary care.
Does the primary care physician also kind of act as an advocate so that even if someone has to go to a specialist or something else, that you have the I guess the total knowledge of that patient?
Yes.
So that you can connect the pieces?
Right. The trend nowadays is for people to come into what's called a patient-centered medical home. And so the primary care doctor is the captain of the ship in the patient-centered medical home. He should have the knowledge of all the specialists, should report to him, and he's supposed to be the central caretaker of the patient. So if they go, for instance, if they have to go to the cardiologist for heart problems, well, the next time they come in, the primary care doctor should have all that information at his fingertips so he can continue to take care of the patient the way the specialist wants to. Now, sometimes the specialists get a little overzealous and they want to take over and kind of push us in the background, but it's real important for us to stay in there and hang in with the patient and make sure they get what they need. Because realistically, if somebody's being taken care of by 3 or 4 or 5 or 6 different doctors, one person has to be in the middle to manage that and say, oh, Dr. X over here, your cardiology is interfering with his oncology treatment, and somebody needs to be able to watch all that.
Yeah. And to me, that's probably the number one reason you need that primary physician, because if you don't, there could be
that's exactly
a
right.
problem.
And if medical care gets fractured, like if you have a doctor for each and every little thing that's wrong with you, well, you're not going to get cared for holistically.
Exactly.
And it's been well proven that if somebody is cared for with somebody looking after everything and making sure that there's no interactions that are unfavorable, the patient's going to do much better in the long run.
So what would be the best way for a new patient to contact you?
Generally, we do all our contacts through the telephone. We're kind of
Okay.
old-fashioned.
Okay.
A person will actually answer the phone and talk to you, person to
Okay.
person. And phone number is 817-465-8855.
Okay.
And that's absolutely the best way to contact my office.
Okay. Excellent. Thank you.